Namaste.
Welcome, everybody. I'm Dr. Guillermina Solis, and so happy to be with you today to bring additional information. I know I saw some of you this morning in our earlier seminar on age-friendly health system. Right now, we're going to switch gears a little bit, and so happy that you're with us. As a follow-up, we have done this presentation in person at the Bartlett Long-Term Care Facility or Assisted Living last week to a live audience, and really arose a lot of questions. So I hope that as we speak on this subject, you would feel free to ask questions related to the content. This is geared towards caregivers or anyone that is interested to learn more about Alzheimer's disease and dementia-related behaviors. It is presented at a fairly basic level, and we will go ahead and present some slides to you. And then feel free to put in the chat any questions that you have. But first of all, I wanted to give you thanks for being the caregivers, whether you are a professional caregiver or a personal caregiver to a loved one. You are the true heroes of service to the people that you love as well as to our community. And to that, I'm very grateful. So with that, I'm going to go ahead and share the slides. In the meantime, if you would be so kind, I believe you already completed a pre-survey. Is that correct, Maria?
No, they don't have a pre-survey, Dr.
There's no
Solis.
pre-survey, there's no registration or anything like that. You have already taken care of that? All
Yes.
righty. So let's go ahead and jump in right into what we have prepared for you. So as you can see here by the title, it is Introduction to Alzheimer's and Dementia-Related Behaviors. Like I said, I am Dr. Guillermina Solis, and in the forum, Maria Llamas, our program manager, and Marcos Garay, assistant to Maria in the web program, is with us. This is a program that is brought to you by the UTEP's Geriatric Work Enhancement Program in the Borderland. It is a HRSA grant that was awarded to us in June 2024, and we're about to complete our first year. Let us begin by remembering how prevalent Alzheimer's disease and related dementia is. 1 out of 5 persons age 65 or older by the year 2040 will be affected by this condition. And in this slide, you see here, this is data from the Alzheimer's Association 2024. You see a 3-tier bar here or presentation, and the purple area represents the persons ages 85 plus who are the fastest growing population and yet have the largest prevalence of dementia. So we can see in the younger, which is at the bottom of the table here, you will see at the axis, you will see that 65 to 75 4-year-olds are less, and then 75 to 84 are right in the middle, and then the prevalence increases at the age of 85. And by the year 2060, you can see that by the year 2060, how many millions of people, nearly 14 million people, will be affected by this disease. So what does that mean? It means that you as a caregiver are directly or indirectly affected by it. And a caregiver, like I had mentioned previously, is formal. That means that it could be a person that is getting paid or somebody that has been assigned to caring for the person, or an informal person such as loved ones, families that are either rendering direct care or are overseeing the care of a loved one. So I want you to take a moment to reflect and thinking about what are the challenges that this disease presents to you in managing your loved one, and specifically how are behaviors observed and how are they being managed by you or those around you, and how is that impacting you. So kind of think of put yourself in that moment and jot down a feeling or a challenge that you can share with us if you like, or we can walk through. So why might someone engage in these behaviors? Let us remember that our behavior is not something that we control. It is something that we accommodate to, meaning that we try to manage it, but the behavior may come from the disease itself. With that being said, I will share with you an introductory video on what dementia is.
Dementia is a general term that describes the loss of the ability to think, remember, and reason. People with dementia have difficulty completing everyday activities, and symptoms worsen over time. Dementia happens when nerve cells in the brain stop working properly. There are many types of dementia. Some types include Alzheimer's disease, frontotemporal dementia, Lewy body dementia, and vascular dementia. Some people may have changes in their brain caused by more than one type of dementia. The risk of developing dementia increases as individuals grow older. Most people with dementia are age 65 or older, and research shows that about 1 in 3 people age 85 or older in the United States may have some form of dementia. Still, dementia is not a normal part of aging. Not everyone develops it as they grow older. Scientists are working to discover why some individuals develop dementia and others don't. While healthy lifestyle approaches, such as regular exercise, may help some people reduce their risk of developing dementia, more research is needed. Dementia can cause problems with thinking, memory, and behavior. Some people may also have trouble controlling their emotions and may experience changes in their personality and movements. Symptoms can vary depending on the type of dementia, but common signs include difficulty understanding or expressing thoughts, memory loss and confusion, getting lost in a familiar place, trouble handling money, or losing balance. However, these symptoms don't always mean someone has dementia. Dementia-like symptoms may be caused by depression, side effects from medication, vitamin deficiencies, or other medical conditions. Talk with your doctor if you have concerns about your ability to clearly think, learn, or remember, or if you notice changes in your personality or movements. Doctors can help determine whether your symptoms are caused by dementia or another health condition. If you do have dementia, obtaining an early and accurate diagnosis can help you manage the disease through potential treatment options and help you plan for the future. Learn more at alzheimers.gov.
So as you can see, the complexity of this, the event that this condition presents to the brain is quite significant. So what we will do next, we will explore the behaviors associated with this condition. Because some of you may not be aware of the 10 early signs of dementia, we went ahead and created this slide for you to give you an overview of some of the conditions that often bring people to healthcare providers and the most common symptoms of the dementia. We talked about memory loss. We talked about problems with getting lost, so spatial awareness may be lost, difficulty performing tasks. This is something that is very relevant in asking the person as we interview him, how does the memory impact the activities that they do? They may get disoriented. They may have a decrease in judgment. They may do things such as not able to handle their everyday finances, whereas before they were very much involved with it. There may be changes in their mood or personality that are observed over time. They can displace things, and displacing things is not just I forgot where my keys are and remembering, but actually not being able to remember or find them in places that may be really out of the ordinary. Withdrawing from social work activities is fairly common at a more advanced level. And then problems with language and communication that is often observed in the moderate to severe dementia. and definitely having difficulty in planning or solving problems. So as you saw some of these early signs, you may think, oh my goodness, do I have dementia? Well, it is not a diagnosis that can be made in one sitting. It is a rather continuous evaluation, and a person should be referred to their clinicians for further evaluation. Let us look at the brain a little bit. You've seen this very colorful pictorial depiction of the brain. We see here the frontal lobe, which is the near our forehead. That's the part that holds a lot of the emotions and very key activities or relevant activities to our daily day activity and functioning. We also have the temporal lobe, which is in the lateral aspects of our brain, and is depicted here in this section. And how that relates to what we do is in the following. We see that in the frontal lobe with the executive function, the ability to make decisions, to get organized and plan may be impacted. The motor skills, the ability to have that dexterity to grab things, follow simple motor activities, motor skills. Their speech, because is in the frontal, is part of the frontal lobe, an area where that is embedded, may be affected, and definitely personality, the judgment, the self-control, and emotional regulation. Memory in the short term is housed here, and the memory storage is here as well. We lose focus in the attention and awareness if there is some impact in that area, and our ability to problem solve is definitely affected. When it deals with the temporal lobe, we have more of a functional activity that is necessary. Hearing is affected, and if not corrected, it can create social isolation as well as greater impact in the functionality and ability to relate to others. Language is impacted, so they may not be able to understand the spoken words, or they may not be able to say them. And believe me, I am not having a temporal lobe crisis right now. It's just that it's difficult to speak to you while I'm not seeing you. So please forgive my stuttering. Emotions come also as part of in the temporal lobe, and definitely memory, but it is in the as storage of those memories, the access of storing. So it is not unusual that a person may remember what they were doing 40 years back and fire their employment, but not able to remember what they ate 40 minutes ago. Visual perception is very much affected, and so they have more of a visual spatial impairment and not able to recognize faces and scenes that are presented. So what does all this mean in behaviors when we put the impact in the frontal and the temporal lobes? Well, we see that symptoms may occur at a younger age when there is great impact in these areas. And personality is one of the first things that may be observed by loved ones, such as apathy, meaning that they are not interested in things that before were of interest. They may have this inhibition, things that before maybe they were very shy, would undress very much in their privacy. They begin to be more overt in their activities, or they may show some aggression. They may lose the empathy, the ability to be empathetic, meaning they may react inappropriately in situations and may lose their control and concern for others. Impulsive or inappropriate behaviors are often observed. And one of the biggest things that families often relate is that their loved ones withdraw from social activities. They do not want to go out and participate in family activities. They prefer to be isolated. And a clue that we often ask family members is, how are they doing with their hygiene? Oftentimes they begin to neglect their hygiene, whereas they were very clean, very neat in their appearance and dressing. They began to slack off, or there are some changes there. Memory is definitely impacted. It is most often in vascular dementia, you see it more severe, but in Alzheimer's disease, it's less severe at the beginning, but then it accelerates, and it is a lengthy disease. Confusion and disorientation is part of the behaviors that is often observed. So confusion may be getting lost or disoriented. A case that comes to mind is somebody that comes and says, something must not be right. I always follow my GPS and are able to follow through. And now all of a sudden, I look at it and I couldn't even make heads and tails of what I was looking at and getting lost. Hallucinations or delusions may be also observed, and that often may happen when there is a coexisting conditions such as an illness or something that leads to delirium, which is a sudden change in the condition. Appetite is decreased oftentimes, and therefore the weight is affected with a decreasing weight. Sleep may be also affected, and oftentimes people refer to it as sundowners, or they might get their days and nights mixed up. But let us not focus only on the symptoms that we talked about as signs of dementia. One must always consider when your loved one suddenly has changes in behavior, or there are some changes that you had not seen before, or acting out. We need to look at where the person is as far as in the continuum of the disease, because if they are not able to express their discomfort, they may act out, and oftentimes maybe because of pain or discomfort. So checking their clothing to make sure that it's not too tight, checking their footwear, their shoes to ensure that there is a safety there, as well as nothing that could be bothering them, because they may not be able to express at an advanced level where that is coming from. Definitely when a person is going through pathological, meaning an abnormality in their metabolic system or a sudden infection or an infection ongoing, their behavior may be the first thing that is impacted, and loved ones may begin to notice that. So those are the two instances where you need to be very astute and alert and don't dismiss it as part of the disease that they are exhibiting. Older adults do not often present with overt fever like children or young adults do. And even if they have a 1 to 2 degree increase in temperature, their behavior may be affected and may be considered fever if they are above their baseline. Dehydration is a big concern, especially in this area where we live, where our temperatures are now beginning to rise. And oftentimes elderly may not perceive the temperature changes as easily, or they may not feel the temperature changes because of the physiological changes that they have. Therefore, dehydration may be an issue. So maintaining good hydration, and that is calculated based on their weight. So make sure that you speak to clinicians about this as to how much fluid they might have, and also keeping in mind that there are health conditions such as heart disease or congestive heart failure that oftentimes requires that the person has a specific balance within the fluids. We always must look at medications that the person is taking, making sure that they are taking them correctly at the right time, the right dose, and more importantly, that it is the correct medication for that patient, and be alert to what the potential side effects may be, because the behavior may be and that is exhibited as or rather the behavior is impacted by the medication. So chronic illnesses also impact behavior. And a common chronic illness that we see in this region, of course, is diabetes. So hypoglycemic, that means when the sugar is low, can have a much greater impact and faster than hyperglycemia, but both may influence the behavior. So is there a typical presentation of the frontotemporal dementia, which is the commonly exhibited with behavioral changes and maybe mixed with all the other types of dementias and impacting the behavior? And the answer is no. There's no typical behavior. In other words, the disease does not follow a pattern. Every person exhibits different behaviors based on many factors, one of which is the personality of the person, the disease process, where they are in the advancement, or what influences in the social system may have, and of course, what we just spoke of, any of the chronic illnesses or medications that they may have. Therefore, it is very, very important that even us as caregivers, formal, such as myself, a clinician, or any informal as a caregiver, know about the person. We need to know what they used to do, what are their likes, what are their dislikes, what are the triggers that made them happy, or things that we should avoid. Why? Because all this matters when we deal with behaviors, not only in the presentation, but how we're going to react to it. The changes in the brain affects persons with dementia at different rates and in different ways. So it is a totally highly individualized disease process. And therefore, like I said previously, we're not trying to control the behavior, but rather we are adapting and helping the person go through the behavioral changes in a safe manner. In remembering that there's a decline in judgment and inhibition, we must maintain an open mind. Why? Because the person may not be aware of their own behaviors. One of the common things that and that you might have already experienced is the repetitiveness of either verbal cues or the conversations. And you are like, oh my goodness, you have told me that story of 20 times in the last hour, and it can get to a caregiver's nerves very quickly. But remember, the person may not be aware of their own behaviors. So we adjust in responding to them, and rather than always being aware that what are the consequences of that behavior. If we are observing that somebody may be a danger if they are driving, we definitely would need to discuss ways of may perhaps accompanying the person, or may get to the point where the keys of the vehicle may be taken away, or having the conversation of no longer driving. They as oftentimes may not observe social rules. We're a society that we want things to go a certain way, and their brain is not working like it should, and therefore behaviors, untoward effect behaviors may be observed. Oftentimes, the person when with advanced dementia, or when they are first diagnosed, which is unfortunately dementia is diagnosed rather late, because we attribute sometimes behavior changes to normal aging, which is not so. And so therefore, the person may get lost. And so we have to know how to redirect them, how to keep them safe. And there has been cases where persons have been accused of shoplifting because the behavior that they exhibited was picking up things. They saw something, they pick it up. Remember, they don't have that judgment, that intact judgment that we normally have. And therefore, all this, the way they may exhibit that behaviors may be in a negative way. So how do we respond to those behaviors? How can we help our loved ones have better outcomes? In other words, not be punished, not be hurt, and to support them as much as we can. It is an everyday battle, and sometimes it's even an hourly task that unfortunately it falls quite a bit on the caregivers. So let's look at some of the ways that we can help our loved ones. Well, when we have a conversation with them, just be aware, be in that space. We are very good at multitasking, but when we are communicating with our loved ones, speaking slowly and clearly is very helpful. It will allow them to, at least for that moment, to get their attention. You don't want to reach from behind them. You want to always approach them in front of them, making the eye contact contact at all times, and allow the person, if you ask the question simply, uh, short, and wait for the person to respond. Remember, we looked at the temporal part of the brain, and so that speech is housed there. So, and hearing is housed there. And so we have to allow that process to go through so that they can have time to respond. Arguing is not going to get us anywhere, because remember, it's their perception, is their space. And so arguing is only going to aggravate the situation. Give visual cues. So if you're offering somebody, for an example, would you like, you want soup, show him the soup, or you want a chip, show him the chip. So they can make that visual connection to the item. And so in a sense, you are giving them those cues. Speak with gestures. It is a great time to have a happy or pantomime-like face or expression so that there's greater communication. And be aware of the tone that we use when we speak, because we can use words that are not so ugly, and yet our body language or the tone that we use may convey something different. So consider that they are not people that do not have feelings. They still have feelings. They just may not be able to express them. And ask them to point or to gesture if they want something. It's okay if you don't know what to say. If you are trying to communicate with you, or they're trying to cue you to something and you don't understand, it's okay to say that you do not understand. We don't have to have an answer to everything in response to what they're telling us. And when we have that conversation and we are asking questions, we want to be as specific as possible. We want to limit the choices that we give them. If we take them out to eat or to a fountain or something like that to have something to eat, we don't give them an array of a menu. We tell them one or two things. So would you like in this example, would you like coffee or water? There, rather than to give it open as what would you like to drink? Don't repeat the exact same question if they seem confused. So reframe the question, maybe make it simpler or use different words. You want to also, like previously said, you want to cue them and making it, if something does not seem clear, you want to go ahead and offer them that opportunity to recognize. And do not carry on conversations that are just all over the place, just very focused and short sentences. It can be very distressing when you're throwing a lot of conversations, a lot of situations to them, or a lot of questions, and it will oftentimes, this is especially important on persons that are in the moderate to severe cases of the disease, and so it will create a lot of anxiety. So giving them the instructions, make it as simple as possible, one step at a time. Speak slowly and clearly with gestures and modeling. So you do not need to repeat everything. You can prompt them. This is like a summary, and make sure you are in front of the person when giving them instructions rather than to the side. It might startle them. There is limit at the later stages of the disease. The peripheral vision is impacted, and so they are in addition to that, some of our elderly may have macular degeneration, which limits the perceptual vision. So therefore, it's not a good idea to come from behind, startle them, or show them something that they cannot see from the periphery. Avoid giving them instructions that require abstract thinking. In other words, making them come up with a story. That would not be something that may be able to do, and therefore creates an anxiety event as well as negative behaviors. So when we see behaviors that are not, that can be dangerous or that are annoying to us, and we need to help them, we use a word that is called redirecting them. So redirection is every direction is a useful tool. Especially true when people begin to wonder, when patients begin to wonder, or they are repeating the same thing, or suddenly they are, they were at the table or they were participating in something, they suddenly get up and move on someplace else. And so what we do, we offer another activity. So if they start to wonder, we can go and touch him and show him something that they usually like to do and bring him to the table to move him away from that distraction. And we make the situation, the activities short so that they don't have to sit there for very long. They become very fatigued and they do not know how to express that. Bring up conversation points of items or things that they like. So if they are there most of the time, they were surrounded by family, talking about their grandchildren, perhaps, or talking about their profession or the work that they used to do, or asking them about it. I often speak of what my sister, who had dementia, was like, and she was a nurse and she worked intensive care night shift all the time. And one of the interesting things is that she would go into her nursing mode, and that would be the way that I would communicate with her, communicate at that point, and then with those conversations to get her to eat or to walk or to get out of bed to motivate her. And so these strategies have been shown to be effective. It is written in care uh, journals and through research of how effective this is. Meet the person where they are. Posturing back, in other words, when engaging them in the activity, get them to be interested in what's there. Sometimes they like repetitive motions, so giving them maybe towels to fold, or if you are cleaning, giving them a mop so they can move around, always keeping safety in mind. If their gait is not steady, maybe that's not an activity that you want to get them engaged in. And if the person begins to wander or getting away from the area where you are, you can put some barriers, some physical barriers, perhaps a chair, or maybe if they wander or they get out of the house, you want to put the door lock up above them so they cannot see it, or below. A strategy that has works very well for people that get out and wander is to put a black mat or paint the area black, because then he perceives it something that they cannot go beyond. So those are some strategies, and we can always help you with that, as you go through support groups, which we will speak of a little bit, then you can learn some of the strategies that people are using. So how do we prevent physical aggression? We all fear physical aggression. And so what does that mean? Is that where they literally become physically uh, aggressive and may endanger others. And so we always have to look at what drove that behavior, what was happening in that situation. And if it just came suddenly, maybe they saw something, maybe they're having auditory or or visual hallucinations, and we need to be aware of that. They may not be well, meaning that uh, pathologically something may be going on, or the tone of the voice trigger a negative sentiment. And so you wanna, if your loved one turns to be that way, it is perfectly to step away and redirect them as much as you can. Provide them an alternative activity. Oftentimes nighttime, when the night is coming and sundowners occurs, they may get rather restless. And so one way that you can do is, as the evening is closing, and rather than to wait for the night for the darkness of the night, you can turn the lights on earlier so that there are not those shadows forming, and it may give them better transition into the time that is changing. So make alternative activities as much as possible. And sometimes you might have to just leave the person alone and give them space to recompose. Additional skills that we want to gain is to always keep the area as where they are as uncluttered as possible. They tend to focus quite a bit in things that may bother them. Like as an example, my sister used to love to pick up things from the floor, even the tiniest things. So we had to keep everything very clean because all of a sudden she would just bend over and try to pick up things. So just because they reach down to grab something, it doesn't mean that they cannot do it. It's just that we gotta be mindful that as they pick up these things, they may be unsafe, and always keep that area clean. So keep everything free of clutter as much as possible. They do like to hoard things, so helping them clear out that area and keeping them so where they can move more easily since their mobility is impacted. And refrain of being a bossy caregiver and telling them what not to do, because then that will aggravate him. Rather, remind them of what they can do. Instead, give them an activity that you know that they like doing, and it's simple and it doesn't require too much thinking. So I think I've spoken enough about all this, but I want you to go back to where we started, and that is, how does caregiving affect you? What is that one challenge that you have that you struggle with? And how do you manage that? It doesn't necessarily have to be behavior, but how are you doing with the demands of caregiver? I know some of you have loved ones who you have to check on them several times a day, and it weighs heavily in your mind. But what does the caregiving, how does that impact you? Because you as a caregiver are the link to that person's life. And so we want caregivers to be as careful of their own health and to take care of themselves and to step away if needed, and perhaps get support from other family members to give you a break even for a day. Because caregiving is one of the most stressful if I may say, duties or activities that we do. And there is plenty of research now available that links caregiver stress to many pathological conditions. So definitely we want you as a caregiver to be as healthy as possible so that you can continue to support your loved ones for the rest of their time. So if you would, I'm going to go ahead and conclude here, but and then we'll open it to questions. I thank you for being in this beautiful space, and I want to remind you that us in the web team are fully committed to bringing any educational resources that we have available regarding geriatric care, and as well as how can we support our youth to gain interest in the geriatric science, and not necessarily just caring for the adults, but even in the scientific, like with Dr. Kristen Gosling as a researcher in the aging process and dementia, and learning about this so that we can advance the science.